Tim, I realized when you said you liked my avatar, I'm like, I have to change the hair color on my avatar.
Yes. Nobody will recognize you. It's a different color.
I like how the guy on the slide has a man bun. I don't think I noticed that earlier.
I don't see it. Everybody's on this side for me, so I
Mm.
don't see that. I can move you, but oh, there we go.
Oh, hi, Amy, and hi, Grace. So we have two attendees right now. I'm glad you could join us tonight.
Actually, Amy, I believe you're already in the program because I was looking at the class list today.
Okay, so while waiting, I would like to introduce myself. I am Alexandra. I am the Student Recruitment Assistant here at SAIT. So I would like to welcome you to the Ophthalmic and Optometric Assisting Certificate Information session. So we'll just wait for some of the attendees before we officially start the presentation. Oh, hi, Grace. I just saw your reply right now. Yeah, thank you for joining. Good evening, everyone, and I'd like to welcome you all to the Ophthalmic and Optometric Assisting Certificate Information session. Thank you for taking the time and joining us tonight. We will cover important information related to Ophthalmic and Optometric Assisting Certificate, and we will also answer your questions pertaining to the program at the end of the presentation. So we will be joined by our subject matter experts, and the presentation will be followed by a question and answer portion. But before we start, I would like to do a land acknowledgement. SAIT is located on the traditional territories of the Niitsitapi and the people of Treaty 7, which includes the Siksika, the Piikani, the Kainai, the Tsuut'ina, and the Iarhe Nakoda of Bearspaw, Chiniki, and Goodstoney. We are situated in an area the Blackfoot tribes traditionally called Mokinstis, where the Bow River meets the Elbow River. We now call it the City of Calgary, which is also home to the Métis Nation Region 3. So just a few reminders for our audience who are watching virtually. Please make sure to use the Q&A button on your Zoom toolbar to type in your questions. Your videos and microphones are currently disabled. So please type in your questions instead of raising your hands because we are unable to unmute you. Please save your questions and send them at the very end of the presentation, as some of your questions may also be covered during the presentation. So for tonight, we are joined by our subject matter experts from the School of Health and Public Safety. We have Kim Penner, the interim academic chair, and Myra Madrileos, one of their academic advisors. Please say hi to our audience.
Hi, everyone. So I'm Kim. I'm excited to be here with you this evening to tell you a little bit more about the program here. And I'm joined by Myra, who I'll let her introduce herself.
Hello, my name is Myra Madrelejos. I'm one of the instructors in the Vision Care program, and I am a certified optometric assistant by profession. So this is totally up my alley.
Excellent. So Myra is going to start our presentation tonight, just giving a little bit more information about the program. So Myra, I'll let you begin.
So the Optometric and Ophthalmic Assisting program is pretty unique. We're the only one in Canada that offers training in both optometry and ophthalmology. The certificate allows you to work in both professions. If you are unaware of the difference between the two, optometry is kind of like the family doctor. It's the primary vision care provider. Then if you had, or if a patient rather, had some kind of eye problem or eye disease, they're referred on to an ophthalmologist. So they're the specialists in terms of eye disease. They're also the surgeons. Our program is 8 months, so 2 semesters in length, and it is face-to-face with a combination of theory classes and lab courses as well.
Great. Thanks, Myra. And now Myra's going to tell you a little bit more about what it takes to succeed in this program, or the attributes that we like to have.
Pretty much like most healthcare professions, one of the most important things is wanting to help people. I always tell people this is one of the really great ones because you're helping people, but there's no blood and guts involved. So as you can see on the screen, it's very much working in a team environment because you'll be basically, as the assistant, you're almost coordinating the entire team. And that's the doctors, the other pre-test or medical staff. If you work in an optometry clinic, you're probably also working with opticians and all the staff that work on the eyeglass side of things. And there is a lot of detail in what we do. And so that's why it says it's very much a detail-oriented kind of job. Basic computer skills, because that's how we enter patient information and gather that information and store it. We teach you those skills in lab. Having a strong interest in healthcare and wanting to help people. We teach you the eye stuff. So you don't have to come in with knowledge about the eye or eye care. We take care of all of that for you. Probably the biggest one is just a genuine desire to help people, understanding that this is a public facing job. And so there's a lot of communication, a lot of talking, a lot of different patients out there, so a lot of situations. So you have to be really comfortable with working with the public.
Great. Thanks, Myra. And now kind of the question that everybody wants answered is, what do I need to get into this program? So you have to have 3 courses. So a math 30-1 or 30-2, English 30-1 or English language arts 30-2, a biology 30 or science 30, and you must have an overall average of 60% in these courses or the equivalent to these courses. All applicants must also demonstrate English language proficiency, okay? And there's different ways to do this, okay? There's 4 or 5 different ways. You can take a program here at SAFE called our English Language Foundations, and you have to have level 5 in that, or you can have 3 years of full-time study taught at an English secondary school, or at least a year of post-secondary education taught in English at a recognized institution, or you can also complete a recognized credential from a SATE-approved post-secondary institution, and the course must be taught in English. So there's different ways that you can demonstrate your proficiency, in English, if English is an additional language to your first language. You are placed in a practicum in this program, and it is a 4-week practicum at the very end of the 2nd term. And in order to be eligible to be placed in that practicum, there are a couple of requirements. You have to have a police information check that includes a vulnerable sector check. And you can get that done by your local police service. And for example, if you live in Calgary, you can have it done by Calgary Police Services. And before you get into the program, we just want to make sure that it's a correct fit for you. So we do ask that you take a look at a health and wellness status and make sure that the assisting program is the right fit for you. So for example, if you had a physical disability that maybe limited vision or hearing, or had a medical condition that inhibited your range of motion, we'd just like you to take a look at this wellness status to make sure that we can help you be successful in the program and that it is a correct fit for you. Right, so I'm going to pass things on to Myra again, and she's going to talk about the specific areas of study during the program.
Yeah, so as I mentioned earlier, it is a 8-month program, so 2 semesters. Your first semester is all theory. And so that's why I said you don't need to know the eye stuff because we cover that. You have a class that's the introduction to ophthalmic practice. We talk about what are the different facets of eye care and where are assistants placed within that team. There is a pharmacology class, general anatomy and physiology, as well as ocular anatomy and physiology. And then we start looking at some of the tests that assistants may do in practice. That also will cover things like the anatomy and medical terminology within the 2 anatomy courses. When you move on into second semester, there are 2 theory classes. One of them is about ophthalmic and optometric testing. So we go a little bit deeper into the type of tests you may do in either type of clinical setting. Your other theory course is called applied surgical assisting. And so you learn more about what it's like to assist and help with some of the ophthalmic surgeries. So that's more geared towards the ophthalmology side of things. Most importantly, there is a 4-hour lab every week, and that gives you the chance to practice these skills. Anything from how to take a case history and ask patients what brings you into the clinic today, right up into working with all of the instruments and doing the tests that you may have had done yourself when you've gone for an eye exam. That second semester is 11 weeks. And then the last 4 weeks of the semester is when you go out onto practicum. And so we do ask if you have a preference at the beginning on whether you would like to be placed in optometry or ophthalmology. You can say no preference if you don't really know the difference or if you really don't have a preference. And we also give you the opportunity to change your mind later if once you know a bit more about eye care, you do develop a preference. Our 4-week practicum, you can be placed anywhere in Alberta. So we do have sites in Calgary, but we don't have enough for all of our students. So there is a chance you may be placed, say in Edmonton or Red Deer or Lethbridge. Yeah, and that's pretty much the program.
A very interesting, diverse program. Great. So, Myra, if you wouldn't mind talking a little bit about after you graduate, what happens?
So after graduation, you see that median starting salary there. It really does depend on whether you end up in optometry or ophthalmology. You see way more optometry clinics out there. Ophthalmology is one of the more difficult specialties in medicine, which just means there's less ophthalmologists out there. You can be placed in private practice, both optometry and ophthalmology. If you end up in ophthalmology, you may end up in the hospital setting for surgical type stuff. But you can also end up in things like working in an optical store and working with opticians or being a frame rep and going around showing staff different frames, or you can work for any of the ophthalmic pharmaceutical companies. There are a number of ways you can branch off from this job. So it's not just assisting the doctors. Um, Part of that introduction to ophthalmic practice is actually talking about what are the different jobs out there, because there's way more than people actually think in terms of eye care.
Good. Thank you, Myra. And now, Myra, if you could just talk a little bit about SATE's program and their connection to industry.
We're very lucky in that we have some very strong connections to the industry. Some of the logos you're seeing there are private clinics that have partnered with us and they take our practicum students. There's a mix of optometry and ophthalmology there, but we also have the support of industry partners. So you may recognize some of these logos like Zeiss or Nikon or Essilor. All three of those companies provide eyeglass lenses. Johnson & Johnson Vision Care and Bausch & Lomb you may recognize as contact lens suppliers. And so some of these companies have offered scholarships to our students, and they also support us with frames so we can practice adjusting them, lenses so that you can practice how to measure the power in lenses. You're going to see a video of our lab and you can see that it's outfitted pretty much exactly like an optometry clinic. And so when you're in lab, you're in that environment that's very similar to what you would do at work.
Great. Thank you, Myra. So why choose the SATE program? Well, at SATE, we're applied learning, so it's hands-on learning. As Myra mentioned, you're going to have lab classes that you actually get practical hands-on opportunities to work with the instruments that are used in the different offices. I'm going to let Myra speak more to the lab facilities as she's in there on a daily basis. So Myra, I'll turn it back to you.
Sure. We are one of the newest labs at SATE. Our program started in September of 2020. So it still has a bit of that new factor to it. And as you'll see from the first video, it is very much set up like a clinic. What you're seeing on the picture right now are two of the instruments that are used to measure eyeglass power. So when somebody comes in and we don't know what they're wearing in terms of glasses, we can actually measure them with those instruments. You'll see as we go through the video that we have 3 exam rooms, again, outfitted exactly like you would see when you go for your own eye exam at the optometrist. We also have a diagnostic imaging room. So we teach you how to use some of the imaging equipment and visual field equipment that you'll also see in clinic. There are a ton of different models out there. So we teach you how to use ours, but we also teach you the principles behind these instruments so that you are able to use other models out there. A little later on in the video, you're going to see an area where there's 3 big machines that unfortunately, as assistants, we don't use, and so we don't teach you that part in lab, but we teach our optician program. We teach our students there to actually make eyeglasses as well. The equipment that you're seeing in the lab is also very up to date, again, because our lab is so new. Our instructors are all from industry. So I was an optometric assistant for just about 18 years before I made the switch to teaching. We have a combination of licensed opticians and contact lens fitters. We have, I have more of a background in optometry. We have someone who is a certified ophthalmic tech. So she has more of a background in ophthalmology. So you're learning from people who are actually doing the job. We've done what you will be doing. And many of us have way more years of experience than we care to admit. And it's a very tight-knit program. You'll see that our class sizes, or not sizes rather, but our class composition, we have a really great group of students that come in, and we've seen students kind of become friends even past graduation.
Great. So I'm going to go ahead and Myra, I'm going to show the first video here. If there's anything you would like to speak to, please jump in.
Oh, sure. I felt like I should have put music to it, but I never did get the chance. So you'll see that we do have that set up that kind of looks like an eyeglass shop. So part of what you learn is basics on how to frame style or choose frames for patients. We're now turning into the diagnostic imaging room. And so some of this, again, you may recognize this from your own eye exams. What you're seeing at the very back are contact lenses. So we also teach you how to teach patients how to insert and remove contact lenses. And there's the first of our exam rooms. That one was pretty basic. You're going to see that as we move to the different exam rooms, we've set out some of the different tests. You learn how to use all of this. Some of the equipment you see in there is more for the optician program, but where we can, we give you the chance to play around with the instruments, even if it's not part of the core curriculum. What you're seeing right now is a binocular vision test and the color vision test. So you may recognize those dots on the screen. And then this last area is the optical lab, and that's where we do all of the edging. So teaching the optician students how to make the glasses. Now, this lab section you saw is the half of our lab. The next video is the classroom side.
Well, I'll start this video here, Myra, if you're ready.
Mm-hmm. And so on the classroom side, we do a tiny bit of lecture, but it's primarily so that you can use the equipment that you're seeing kind of around the room. So there are more of those instruments that measure glasses. Some of the tests you're seeing on the table there, some different samples of lenses, but also tests for binocular vision. So that's using both eyes in 3D. We also teach a little bit on low vision or how to work with patients who are legally blind.
Great. Thank you, Myra. So that concludes the end of our presentation. Ooh. So thank you very much for joining us. As we mentioned before, if you have any questions, please put them in the chat and we'd be happy to answer them.
Thank you for that wonderful presentation. I'm just thinking of having my eyes checked in campus because of that. So anyway, okay, I will put the email in the chat, but I have a question from Grace. So she says, I have physics 30 and chemistry 30. Can this satisfy science 30?
Yes, yeah, no, we should absolutely satisfy that requirement. Oh, sorry, you're muted.
Sorry, does anyone else have questions though from our audience? I think only Grace has a question because the presentation was very informative. But for our virtual audience, I will type in the email in the chat. So if ever you have any questions, just send an email. I will put it in the contact details here. So just let us know. And any parting words from our hosts?
I know I would just like, thank you very much for joining us. We'd be happy to answer any questions that may come up as you kind of process what you've seen here tonight. I think it's an excellent profession to get into. There's opportunities to ladder into the optician program if that's something that you want to grow into as well. So yeah, Myra, anything else you'd like to comment on or?
Yeah, I actually didn't even mention the whole laddering part of things. If you find in the assistant program that you're really enjoying the optics and the eyeglass side of things, it is possible to move from the assistant program to the optician program. We could give you more details about that later. But this is a great way to get a sense of what eye care is all about. It's a nice, quick program, and we have had many students finish the assistant program and then do assistant work while they're doing the optician program. So it kind of dovetails really nicely into that. I have been doing this job since 1999, so I'm old, but it's just a profession that even when I've tried to leave, I've always come back because it's so rewarding to work with patients in eye care. So I hope that I get to meet all of you. I am one of the first semester instructors, so you get me right away, and I'm happy to answer any questions that you may have about our program or the industry.
Okay, so before we wrap up, can we just let our audience know when the intakes are for this program?
So this program, or the newest intake, will start May, is it 5th? It's the second week of May when the semester starts. So I believe registration is open right now. And as I said, one of the attendees, I do recognize your name from the class list already. So welcome, and I'm excited to meet you. We have an assistant intake in May and then also an assistant intake in September. So if it's something that you want to think about a little bit more, September is an option. The optician program, there's an intake in September and one in January. So in terms of looking at the assistant one, you're looking at either in a few months or in the fall. Oh, you're muted again.
Sorry about that. I believe that concludes our information session. So for the audience, I put all the email addresses in the chat. So if you have any questions in the future, you know where to contact us. Thank you again, Kim and Myra, for the wonderful session. And
And
thank you
thank
to
you
our
for joining
audience.
us.
Yeah.
That was our pleasure, and we hope to see you all.
Bye.
Bye.